Hello again, everybody. This is Craig Evans of Autism Hangout, and thank you for tuning into this installment of the Ask Dr. Tony series, where once every month or so we sit down with everybody's favorite Aspergers and autism expert, Dr. Tony Attwood, and ask him your questions about autism. And this particular month we've got 5 questions, so if you're ready, Dr. T, we'll just get right to them.
Thank you, Craig, and thanks for that wonderful introduction.
Well, I did want to call you the Doctor of Wonder from way down under, but that didn't fit.
Oh, I like it.
Okay.
I like it.
Okay, I'll use that again next month.
Thank
The first question is, do you have any general information on the co-occurrence of Asperger's syndrome or autism in general, along with bipolar illness? And that's from Lassie, a member of Autism Hangout.
Well, there is actually research on this that was originally conducted way back in the 1970s of finding out that when looking at the parents of a child with autism and Asperger's syndrome, they have a higher than expected level of mood disorders. Now that can include anxiety, depression, but also bipolar, that is mood fluctuations. Now, when I look at someone with autism and Asperger's syndrome, I think one of the core features, and there are several, is a difficulty with the perception, understanding, regulation, and management of emotions. Mm-hmm. Now, this means that that person is very prone to intense emotions. In fact, sometimes the social withdrawal is actually due to being oversensitive to emotional atmosphere, mm-hmm. and wanting to avoid situations that appear quite toxic to that individual. Now, this means that with the emotional variability of the day, the person is likely to have stronger reactions than others. Now, when we say bipolar, traditionally, it's a change in emotions from depression to euphoria over a matter of weeks, months, a long period of time. Mm-hmm. Usually with ASD, it's within an hour that the person lurches from one intense emotion to the other. And the difficulty there is that that emotional range, intensity, etc., can be very difficult to cope with for the person with ASD and others. Now, whether you call it bipolar, I'm not too sure. What I do say is there is a problem with emotion regulation, and I do ask parents and those with Asperger's to have what I call a mood diary. So at the end of the day, you determine what your mood has been like. A score of 0 to 20. 10 for an average day for, say, anxiety. 19, 20, very anxious. 1 or 2, fairly relaxed. And at the end of each day, you have a number, and you plot that over time. Clearly, there are going to be extremes. Something you anticipated doesn't occur, hit the panic button. But overall, there may be a known cycle. I always feel down this time of year. My cycle lasts 28 days. Lunar cycle. It may be a longer cycle. Now that's very valuable information to tell people that I will be emotionally sensitive and volatile for the next day or 2 or week. Please help me.
That brings up the question, do you medicate for bipolar in kids with Asperger's syndrome?
With adults for bipolar, the traditional medication has been lithium, which may not be a drug of first choice for those with autism and Asperger's syndrome. I would normally prefer cognitive behavior therapy because it doesn't really have any side effects and teaches the person to use their intelligence to control their emotions. But you've got to have a certain degree of maturity and insight, developmental level of at least 8 or 9, to use those strategies. Wow. If the person is developmentally younger or the emotions are very intense, medication may help, but that requires a clinician to really know the nature of autism,
sure.
Disentangle what the emotions are, and then prescribe precisely for the emotional problem.
Wow, wonderful answer. Thank you for the insights.
It's a common problem that I have when talking with parents and people with autism and Asperger's is how do I manage my emotions?
Yeah. Well, but your first solution to these people is to try to do it using your own intellect and your own ability rather than a medication.
Also, many of the emotions are a reaction to the environment. And sometimes rather than medication, there may be environmental change and attitude change. Mm-hmm. That can make a huge difference to the person with Asperger's syndrome in particular, is to be understood. But also for other people to read their signals. Often the person with Asperger's is the last to know when they're heading into a particular emotion, but others may pick it up, and then they need to look at strategies to help.
Well, that conversation segues very nicely into the second question from Anja over in Germany, who has a 10-year-old son who's apparently exhibiting some behaviors that require medication. But once they try to remove these medications, things apparently get pretty dicey. But Angela would like very much to have her child evaluated for autism, and that will require the removal of the medications. And so her question to you for this 10-year-old is it worth removing him from the medications and going through all the trials in order just to be able to have a known diagnosis of autism?
My simple answer is yes, but your son needs to be part of the decision making. Because what it means is that for that time that he's off the medication, he is going to show all those signs, and it's how he feels about being through a difficult time for himself so that others can see the challenges that he faces. I think the plan is that at school he is really well behaved, very responsive, almost not having the signs of that medication. They're very clear. To convince people that there is a genuine underlying problem, it may be necessary for a week or two not to take the medication, but the son needs to be very much involved in why this is occurring, and this is why people need to know to help understand his genuine difficulties.
What sort of things would you tell the son in order to help convince him that this is worthwhile?
It's just that you are so good at school and people are amazed about your capabilities, but they may not understand how hard you work to get that degree of achievement.
Excellent.
They need to see you without that help to see how far you've travelled and your achievements in being able to manage not only your behaviour, but also concentration.
Do you think the removing of the term Asperger syndrome is a wise move?
Well, certainly those on the DSM-5 committee have not asked me my opinion, which I find rather interesting. And my concern is that I really don't care what you call it. It's not my name. It's not Attwood syndrome. It exists, whatever you call it. Those individuals have that developmental history and profile of ability. So, as in Shakespeare said, arose by any other name. What do we call it? My concern is if you use the phrase mild autism, it's not mild for the person who's got it. In fact, it can be very profound for that individual and seriously affect their quality of life. But also, if you use the term mild autism, then government agencies and accountants are going to say, well, if it's mild, it doesn't need any support.
Oh.
It's something that a person can work with and will solve itself. It's like having a mild cold. So it needs a name. I can't see anything wrong with using the term Asperger's syndrome. Asperger is dead, and it really doesn't matter for his personal status what counts. But my concern is that many organisations have used the term Asperger syndrome, and I'm not sure how well they will take to be then called the mild autism syndrome support group. But also those with Asperger's have a sense of personal identity with this, and I don't want to change that. But my other concern as a clinician is that sometimes a relative may say of an adult, I think you have signs of Asperger's. Maybe you would benefit from a diagnostic assessment. And they say, oh, Asperger syndrome. Not heard of that. I'll find out more. But if you say, you've got autism, they're like, no, I can speak. No, I don't flap my hands. I'm not like Rain Man. I've got a job. I'm not autistic. How dare you suggest that?
Mm-hmm. Well, Tony, thank you so much for taking the time to come in tonight and enlighten us as you always do, in a very entertaining manner, I might add.
Oh, thanks.
I can tell you're just off your vacation because, man, this is really fun.
Oh, thank you. Yes, I've got some energy. Thanks to all the viewers, really.
Yeah, that's the way I feel. Thank you, Autism Hangout, folks. It's nice to have you tune in. I'll be back again soon with another Ask Dr. Tony series. Good night.